How to check blood sugar with a glucometer.
Using a glucometer to check your blood sugar at home is crucial, especially for diabetes management. This video will guide you through the simple steps needed to use this device effectively. First, ensure you read and understand the specific instructions that come with your glucometer, as each model differs slightly in operation. Standard steps include preparing the device, using the lancing device, and handling samples correctly. Start by washing your hands and informing the patient about what to expect during the procedure. Using warm water can improve circulation, making the process smoother. You will need several items to check your blood sugar: a lancet, lancing device, gloves, alcohol prep pad, glucometer, test strips, and gauze. To prepare the lancing device, remove the cap and insert a new lancet. Remove the needle cover and set the device's puncture depth to suit the user's skin type, ranging from soft, delicate to calloused. Choose a sample site, typically the site of a fingertip. Avoid massaging the area to prevent damaging the blood cells or diluting the sample. Clean the puncture site with an alcohol pad and let it dry completely. Ensure the test strips are compatible with the glucometer, have not expired, and are stored correctly to avoid exposure to light and air. Meanwhile, prepare the glucometer by inserting a test strip, which powers on the device. Once the site is dry, position the fingertip below heart level to enhance blood flow to the area, ready for sampling. Press the lancing device firmly against the selected site and release the button to puncture the skin. A blood drop should form. Gently squeeze the fingertip to obtain a sufficient blood sample for the test. Be careful not to press too hard. Some glucometers suggest wiping away the first blood drop and using the second to avoid contamination from cleaning agents or tissue fluids. Interpreting results. For adults with diabetes, the American Diabetes Association recommends a blood glucose target of 80, 130 mg/dL before meals, and less than 180 mg/dL after meals. Great work! You got this! I wanted to mention these flashcards that I used when I was in school. They include summarized cards with key assessment points, perfect to help with your head-to-toe assessment. They also incorporate memory tools and tricks to make learning fun and effective. I have added the link below if you guys want to check it out.